Okay. So, Micah, this is Dr. Terence Dulin. Dr.
Terry.
Dulin, Terry, this is Micah.
So what's going on? I read that interesting little story you got there. That's interesting.
Yeah, life's been pretty interesting, and what's funny is like when my health crashed, I started like figuring life out. Like I was just kind of floating, not really doing anything, and then this came along, and at first I was like, man, I really screwed up, and like I got the crappy end of the stick here, and then I was like, oh, wait a minute, like I've had an interesting life, and this is like bringing it all together, like all these things that I thought were completely useless, now I like almost trained to like go through all of this. So it's been a really interesting experience, and the most amazing part of it is realizing how many other people are going through stuff like this. Like there's this whole other world of all day long people trying to find this and people helping each other and stuff. It's neat, it's unfortunate that we're going through it, but it's a really cool world.
Yeah. That's how I felt when Terry and I started writing the book. Like we wanted to write the book because of everything that I went through with my liver failure. We wanted to kind of spread the word about.
Well, I was just annoyed at all the idiots and morons who were talking chemistry and didn't know anything about it. Just annoys the life out of me. And
Yeah.
I have had enough of the MTHFR to kill a horse. It just pisses me off listening to all the idiots.
Uh-huh.
Okay,
And you'd think by now that people would be picking up on this, but for some reason everybody's just repeating things that are so old.
because the internet is cut and paste in science. That's it.
Yeah.
Cut this, paste it to that, put it on my website. So it spreads all over the place, but no truth to it, and you don't know where it even started.
Yeah. It's a shame because there's so many people, they feel like they're finally finding the right information and they're trying these nutrients that people are like, this one saved me. And then I only took methyls like, because ever since starting nutrients, like I was like, I don't know what I'm doing, so I'm just going to go slow and pay attention to how I'm feeling. And just taking a little tiny bit of methyls like once a week, like 2 or 3 months in, I'm laying on the floor in here under my red lights at like 2 o'clock in the morning in a fetal position with like, feels like my heart's going to pound out of my chest. I'm like, what in the world's going on? And finally I'm like, holy crap, it's the methyls. And then you go talk to anybody and they're like, well, they helped me, so it can't be that. It's like, well, yeah, I think we're all a little bit different though.
Well, yeah, that's the issue that, that's how you and I kind of hooked up a little bit online, is the fact that it is so frightening to see the amount of people taking methyls when they have no idea how they're methylating. And a reaction like what you had would be more of a hypermethylator like me reaction, as opposed to my daughter who is a hypomethylator.
Or it could also be a downwind problem.
Mm-hmm.
The downwind problem is where you get most of your symptoms from methylation.
Mm-hmm.
Okay,
I
it's not really the MTHFR cycling itself. It's whether or not you've got any of the extras, the PUMT, the COMT, the HNMT. All of these give the symptomatology that people are looking at and thinking that it's MTHFR, and it's not.
Mm-hmm. I think a very simple way to look at it is MTHFR is the safety limiter that says the oil's low somewhere or a tire is flat, and people are bypassing that limiter and going, yeah, the car's going up to speed now, so I'm good. And then that thing finally makes enough noise once they burn out that nutrient further.
Well, they also burn out the homocysteine levels. Eventually, the homocysteine levels drop really low. And when that happens, you shut off your immune system because you no longer produce glutathione. Okay? It burns out the glutamine levels because you have to balance glutamine with what you're doing to make sure that you're not going to burn out the cysteine-homocysteine combination.
Yep.
And when the glutamine burns out, that's a whole new array of symptoms that nobody's even looking at, since it's a hippocampal neurotransmitter responsible for a lot of the basics as far as balance, coordination, empathy, all those kind of things.
Yep.
Things we're missing nowadays.
Yep. And you mentioned something like lithium orotate, and people are afraid of it because of lithium, which I understand, but like, it's not to just say random things, but nobody's looking at these other nutrients. It's just fallen into, you need magnesium and methyls.
Yeah, but see, the lithium orotate, the interesting portion is not the lithium. It's the ortic acid that they're using as a carrier. The ortic acid is in the pyrimidine family. It's one of the cycling nutrients for CTP, TTP, and UTP. So it's going to make the pyrimidines turn on more than anything else by kicking in the recycle mechanism. The lithium is the minimal portion of it. It's not that helpful. All methylators who have faulty systems and use MTHFR block TYMS, which is the other folate gene that takes the 5,10 methylene tetrahydrofolate and shifts it all the way back to tetrahydrofolate, but it does so activating the pyrimidine system. And if you're not activating that, you're going to shut down so much of your DNA protections, your body's ability to turn on antibodies, all of those things. So uric acid is an interesting one. It's got to be coupled with other things. I used to use a lot of that in the magnesium orotate, calcium orotate, okay, not so much the lithium orotate, but the other uric acid precursors to push the pyrimidine pathway. Now we're using CDP choline because the CDP gives you the cytidine diphosphate and jumps in a little bit further down, but initiates more of a response than you get with the orotate. The orotate's a salvage mechanism. The CDP is a direct nucleotide push. So it's an interesting one. Amazing for acetylcholine production.
Yeah. Yeah, I started with choline bitartrate. I can't say that one.
Bitartrate, yeah.
I learned the hard way. It was odd. Like I had tried both betaine TMG and this choline, that form of choline, and I didn't notice anything. And 2 or 3 years into finding, another form of magnesium that helped and just getting random things balanced, I took a betaine one day, and a couple hours later, I was like, oh my God, this is what people mean by high on life. And I realized that I was it caused me to realize, like, hey, if I can feel like this now, that means that I'm feeling lower most of the time. So that's probably a touch of depression. And then 4 hours later, I was like, oh my God, this is how people hurt themselves. Like, I felt nothing at all.
Yeah.
And then, so that was betaine the first day I did that. And I did the same exact thing the next day with choline. And somehow both of them, I just lined my system up to where the other half of my methylation wheel was ready to go or whatever. And I made a bunch of neurotransmitters and couldn't clean them up or whatever happened. But I was like, wow, like I'm feeling those nutrients and then going and seeing where they are in the system. I was like, holy crap, I'm like really starting to see where I'm cleaning these things up and moving forward and going a little bit too quick and clogging this up over here. And I didn't actually see where to go at that point, but I was starting to realize what was going on, and that was really helpful.
You mentioned TMG, right?
Mm-hmm.
Yeah, that I cannot go near TMG as a hypermethylator.
Because of the BHMT gene. This is Amy Yasko's stuff. The BHMT gene cycles homocysteine exactly the same way you would cycle with methylation as far as the MTHFR goes. It's a bypass for that, so that the system has always got a secondary setup, so in case it does crash, it can be bypassed.
Actually, when I ate that orange, didn't you give me TMG just to, what did you give me?
I would never give you TMG. I like you. We don't want to kill you. I'm not giving you TMG.
Oh, you gave me R5P.
Yeah.
Oh, okay, yeah.
R5P is a little bit different. That's going to affect, for your system, the MAO system. And that affects, basically, the overbuild up of epinephrine in the body and balances it off. Since the COMT and the MAO systems basically control catecholamines and serotonin production, you got to be a little careful. They also are phase 1 and 2 liver detox. So in your case, putting in the R5P gives you a protection with the adrenaline breaking down faster, so that even with your COMT, you're not going to have a problem. And it also turns around and it kicks in the phase 1 liver detox, which pulls the stuff out of the system quick.
Yeah, but I couldn't take it for more than what you had me on it for. What happened was
It'll depress the crap out of you.
Yeah, it was all I ate an orange, and an orange is a sulfur food, and which I can't have. But we were trying to.
It's a methylator.
Sorry. I'm only perfect some of the time. So we were trying. My bilirubin was low, and we were kind of
She was
Trying to-
looking to
yeah.
try other foods, and she was bitching and moaning the diet was too restrictive, and she wanted this. And I said, "Okay, you want an orange? Good, try
But
it."
we were also trying to jack my bilirubin, because my bilirubin at the time was a 0.4, which is very low for me.
Well, that was the COVID stuff, and the other things shut down your methylation
Yeah.
completely.
So
'Cause that's what COVID does. But in your case, the inosine was the way to activate all of that.
yeah, so he gave me R5P, which helped me at the time, but after that time period, which was probably 2 weeks, I was plummeting and plummeting, and I know my body like super well, like how you're like, oh, wait a minute, the same thing with me. And I call him up and I'm like, Doc, this is not good for me right now. You need to take. And what it was is he was just clearing out that methylation pathway.
It's a safety valve for MAOA and B. That's what it is. It's a safety valve.
That's interesting. So something that I haven't been able to figure out about myself is when I get excited that something's finally working the right way, I get an anxiety that just I can't move forward. And it used to be like, I used to not be able to do calls like this without just having anxiety through the roof, and now I can do that no problem. But for some reason, when something that I've been working on, a project, finally comes to light, I like crap out and I can't get through it. I like get so excited or anxious.
You're a very creative person, aren't you?
Yes.
Yeah, which means more than likely you're always going to have a lower production of dopamine, norepinephrine, and epinephrine, and you're going to have chronic anxiety. Depends on where that anxiety lives. Does it live in the high end or does it live in the low end? Anybody who's creative needs that, or you can't see the world skewed. You're an accountant. Everything is A plus B. If you can't see the world skewed, it's A plus B.
Yeah.
Only creative people can go A, C gets Z. Look at Z. This is great.
Yeah, look what I found.
Yeah, pretty much. So, yeah, there's a bunch of things that go along with that. The serotonin system and the norepinephrine system are involved a lot with the anxiety production. Okay, so depending on what variants you've got in your serotonin system as opposed to just a straight production run, that will cause a bunch of problems. You'd have to look at TPH1, TPH2, ASMT, and more than likely you'd probably need PUMT, COMT, and MAO to know what that whole set's doing. The PUMT is the gene that controls the enzyme from norepinephrine to epinephrine. So you'll get spikes up and down with the methylation system since it's a methylating enzyme. ASMT is the one that changes serotonin into melatonin for the sleep cycle. So if you're having a problem with methylation, whether over or under, you've got to be sure that those two are kept stable. The COMT is, depending on whether it's upregulated, downregulated, is going to turn around and cause a problem with lowering the dopamine, norepinephrine, epinephrine sequence. So it's kind of an interesting piece.
I have MAOA. I think it's slow. I know I don't have COMT.
Well, how many comps do you have and how many MAOs?
I think it was 2 MAO and no COMT.
Which testing were you using?
This was Strategene through Seeking Health.
Yeah. Probably not a full set.
It's not.
Because there are about 80 MAOs, and there's about 65 COMTs, so it's like, yeah.
And hundreds of MTHFRs.
Yeah, literally.
Yeah, and that's the craziest thing about the methyls is people like, you have MTHFR, you need methyls. You have COMT, you don't take methyls. And it's like, whoa, wait, hold on, guys. There's way more to this.
Well, then the simple question is, which COMT are you talking about?
Yeah.
Yeah, there's so much more to the genetics that just boggles the mind. It makes me crazy.
Yeah.
And we're using right now what you call it, Genome It All. Okay, it's a private company. They're the ones that do a lot of research. They do 700,000 SNPs. Okay, so they're up there. Okay, I only think the better one is Diamo's work out of Rutgers in New Jersey. I think he's got a database there with 1 million SNPs. But these guys are 700,000, and they will give you a tremendous look. It's $349. It's a cheap test, and you don't have to order it through a doc or anything else. You just go on their website, and you can order it, and it will give you a ton.
Oh, wow. That's interesting.
Here, I think I got one up and I could show you.
Are you missing the ability to process that? Do we have to go a different route or something where a lot of the genetics are just like, you got some MTHFR, you got some COMT or PAMT. It's like, it's helpful, but again, people are like, I have MTHFR and COMT. Do I take methyls or not? Like, no, it can't be broken down that simple.
Well, the problem always is going to come down to is that it's most of the genetics are being done by medical research for pharmacology. And that means it's slanted towards pharmacology. Okay? You could take a CYP 1A2, okay, which is a basically a cytochrome P450 enzyme. It's responsible for breakdown of caffeine and estrogen, okay? Except caffeine didn't exist back then when the genes were first forming. So what is it really doing? Well, it's got tons of other compounds that it does. Most of the cytochrome P450 enzymes that are used for medicine are actually in the human body to digest plant compounds and things as we're eating. So when you pick up some food you've never eaten before and you eat it, okay, you don't die from all of the chemicals that are in the plant.
Yeah.
So that's what they were really designed for. And unfortunately, all the gene slants now are, this is about the metabolization of Zoloft. Well, Zoloft didn't exist when that gene was there. That's just what you're saying it is right now. That's part of the biggest issue with this.
Yeah, that's a good way to put it.
Well, people don't get it that these genes were not there to serve as drugs or diabetes. These genes were there to do specific enzyme controls to control things.
Yeah.
And that's what they're not seeing. And when you look at MAOA and MAOB, just because it's an unknown, that means that nobody's researched it enough yet. That doesn't mean it doesn't do anything.
Yeah. It's like our appendix or something. Just take them out.
Yeah, we don't need that. I don't know why anybody would put an appendix in. You know, so it's the same thing with most of the gene stuff. That's why it's such a mess out there. And you've got too many entrepreneurs who are selling apps and everything else without any understanding of what they're doing.
And it's very frightening.
Yeah.
You know, it's really frightening, being that I've lived through acute liver failure because of a toxicity due to an antibiotic, but it really did a job of my already faulty methylation system. And it's so frightening to see that these people out there on, all these different Facebook pages and Instagram pages, and, my friend, her son is suffering from a bunch of different things. And she sent me a short clip of some, like a short on Instagram or whatever. And it was some guy talking about taking methyls, and you need to take a methyl and this will make this better. And I text her back and I'm like, he's an idiot. And I said, it makes me so crazy, because if a person is suffering the way I have suffered, and they just throw in a methyl, or eat fish, or eat leafy greens and all this kind of stuff, my head just boggles, because they only know a part of it, and it's so frightening to me. That's why I put that whole thing out that day where you responded back to me. Because I'm like, no, you can't just, we were talking to...
You have too many David Lynch's, Ben Lynch.
But,
You have too many of him. You have too many of the other ones who are just making a buck and are not clinically oriented. If you're not clinically oriented, you don't understand that a pathway does not necessarily mean that that's what's going on. A pathway is just that, a pathway. And it's one of many pathways where there are multiple redundancies and everything else, so that a human being can live for 70, 80 years without falling apart by the first plant he ate that wasn't any good for him.
Yeah.
So it's so much more interesting. It's interesting when you see people like yourself who are doing things and testing it out and looking at it and researching it. That's far more accurate than most of the people who are just, I'm sick, I heard, I watched a YouTube, I'm doing this.
Yep.
That's crazy.
It's not a one size fit all, and that's what we were talking about with
It's a one size fits nobody.
Yeah.
I've run literally hundreds and hundreds of genetic testing, and I have never seen two the same. I've run tens of thousands of blood tests, literally more like 100,000, and I have never seen two blood workups the same on two different people, ever.
Yeah, and like he does dietary, orthomolecular, biochemical, nutritional programs.
We do weird stuff.
You would have a field day, and it's so interesting because I've been with him for 34 years, 35 years, whatever it is, and the difference in my biochemical program nutritionally, his nutrition program and my supplements, it's so different from how it used to be when I was in my 20s.
Right.
Well,
that all has to be taken into context.
Yeah.
And so does
They
environmental
change.
conditions.
Yeah.
I mean, people who live at the equator don't have the same chemistry as people in Alaska.
Yeah.
Nobody
and
looks
as
at that.
you progress, it changes too. I was eating 200 mcg of selenium a day sometimes, and feeling it help me move stuff. And then sometimes I don't touch it for a month. I was eating magnesium every day for a little while. I don't touch it for a month at a time now.
Well, the problem with a lot of the micro and macro nutrients that are being used, the minerals and things, is they're trying to target specific chemical reactions, which is virtually impossible with a mineral. You just can't target things as accurately as they're trying to make it out. And that's due to a lot of different factors, including absorption rates from the gut. If you already have a high amount in and you put it in again, the body is going to reject it. Okay, if you have a lower amount, it's going to absorb all of it, and it's going to slow down your digestion and things to do so. So there's always contraindications and secondary factors to be taken into consideration. And as smart as people are, if you don't go to school for something, you don't try to build a rocket in your backyard.
Mm-hmm. Unless you really have to, and that's what I did. I had no choice. I figured it out, and that's the only reason I'm talking about it, because I figured it out. I'm not sitting there saying, "No, I read about methyls."
Yeah. No, that's the way you got to do it, and it's very frightening to watch people floundering and throwing things in and not realizing, I was doing great, I'm feeling great. Oh yeah, my blood pressure's up, but I'm feeling great. Yeah. Really? So you think that's working for you?
And also the thing about methylation chemistry is that it changes, I'll get different symptoms
depending on the gene, depending on the thing. You're talking about all the downwind stuff.
Yeah.
The downwind is what really gives symptomatology. MTHFR really doesn't give you any symptoms at all. Mm-hmm. You don't feel a thing from it. It's what it does afterwards. It's like turning on a light switch and not realizing that the light switch not only does the light, but it also does the backdoor, what you call alarm system. It does the stove. It does the, so when you're not looking at it from that standpoint, you're not looking at the whole picture, you're going to cause problems. You're going to leave the stove on all the time. It's going to burn out. Now you got a new problem that you never had before, simply because you're treating a problem you thought you had to begin with.
Yep.
Yeah, but what I was also going to, thank you for that oration.
You got me on a roll. I got
know.
to talk to a patient after this. So
I know.
You know how that goes.
What I was saying is that, with me, with methylators, with everybody methylates, but with people who have faulty methylation, we could feel our body shift. I could feel when my sulfur is cycling, and that's when I'll feel my body pain if my adrenaline tanks, or that's when my adrenaline's firing so hard where I can't even think straight. And, that's when I know when to take what I need to take based on 30 years. But people are just taking things, and if they're feeling this way, then they're like, oh, I need more methyl. And I'm, when it's probably the polar opposite of that, based on their not knowing how they're methylating.
It's still, there's a big difference between clinical application and biochemical pathways. And right now, The internet is trying to sell biochemical pathways as the answer for everything without realizing, no, there's a clinical pathology that goes along with these things. And if you're not looking at that and you don't understand that, you're not going to be able to treat yourself, and you're going to mess yourself up pretty bad.
Yep.
And that's why he gets so many patients. A lot of your, not all of them, but a lot of your patients.
I get most of the weird stuff.
Yeah, but
I don't get a lot of anything normal anymore.
No, I know, but
That's me.
you've
I
said
get people that can't figure out how to get forward, and they're just locked up in some crazy way. They're like, you're talking about stuff that I don't see anybody else talking about, so maybe you can get this unraveled.
Yeah, there's a lot of. I get mostly the oddball, weird diseases, genetic problems, support systems for like pandas and other things like that. Alpha trypsin, alpha gallon. Okay, oddball, weirdy things that are just off the charts, strange. And what we do is try to find biochemical solutions for that using the combination of the food and the supplements. But if you don't use food and supplements, then you're not doing anything.
Yep.
Drugs.
But a lot of people come to you after they've tried to fix their MTHFR, or a doctor who is not trained in biochemistry. They do their best, and then they crash them out, and they're great for a while.
It's Mark and the boys with the functional medicine pushing the one size fits all. It's Mark. Dr. Hyman, for everybody, head of Cleveland Clinic. He's a little opportunistic.
Most people, I mean, Gary Beck or whatever, I don't see anything useful from him. I just see people saying that they felt ripped off by his tests and stuff.
Yeah.
And he's one of the biggest names out there for MTHFR.
Yeah, it's called Make a Buck. There's a lot of them out there like that. He's an idiot, and I've got about a dozen of his genetics in here, and I look at it and it's like, this isn't worth anything. Yeah. This is basically just making money off of you. It doesn't tell you anything. Yeah. I won't use most of the other ones. Dr. Miller has a good one, but it's restrictive. Dr. Miller's whole setup is very restrictive because he's only looking at a certain set of genes. Now, granted, he does look at all the MAOs, but he doesn't give you any understanding of what those MAOs are actually doing. He just says, oh, these are the important ones. Here's the other 85. So it's like you're still doing the same thing, treating one gene instead of looking at the whole thing again. So it's kind of ridiculous, but yeah.
So what do you? I know you're not a functional practitioner or anything like that. You're a web designer or something, right?
Yeah, I work for a nationwide home builder. I'm a systems admin, been a web developer my whole life. And that's what I was doing when this happened, and I started losing all my work because I couldn't think straight. And went to answer the phone one day, and my boss was like, "Are you on drugs?" Because I just wasn't forming sentences anymore, and I was like, "Man, this is."
And that's all from a flu shot?
Yep, I fell for a flu jab. We were living at my wife. I was living with my in-laws, and we moved out a couple months later. Went to a new house that I noticed a little bit of mold here, but it was because of the way the water in the yard was grading. It was going under the house. So I thought that's what it was at first, and then just looking at stuff and thinking about it, I was like, holy crap, the flu jab, ever since that happened, I remember running up the flight of stairs, and I was like, I don't know, I mean, I'm in my early 30s, I don't think I should be getting winded going up a flight of stairs, and that was the beginning of it, and then I started waking up on the floor having seizures, and it was happening for a while, but all of a sudden I finally woke up and still felt like the shock or whatever one time, and I was like, oh, that's why I woke up on the floor that other night. And then was like, why am I on the floor?
That's it. There's actually a gene that goes for that flu vaccine that says that.
Really?
If you have that gene, you're going to end up with seizures.
Yeah, it sounds like it hit me pretty good.
Yeah, you probably got one of those. There's a lot of them out there that if you have this gene and they give you that shot, you're going to have a problem.
Yeah,
guaranteed.
Yeah, I mean, it was about 6, maybe 8 months for it to set in, so it was the timing, and I wasn't paying attention to health at all before this. The only thing I'd done was I did around the Whole30, which is kind of like paleo, and I was like, oh wow, what I eat has an influence on my body, and that was really all I understood about health. I was like, I wonder if I'm supposed to take a multi or not. That was my understanding. Mm-hmm. But then I don't know how I found actually, what's his name, the Root Protocol, Morley Robbins, I have his book, but I found magnesium, and I was in their group for a while, and somebody mentioned iodine. I found that, and the seizure stopped when I started iodine. But then iodine is, the community is, oh, you just need more. So I went in there and I'm like, hey, I'm not feeling good. I'm like working my way up and I'm not feeling right. These symptoms are coming back. I feel like I'm gonna have a seizure again. Oh, you just need to take more. And I was like, that doesn't sound right, but I'm gonna try that. And I knocked myself in my butt. I woke up 3 days after I stopped high dose and my whole body hurt. I couldn't think straight. That's when I lost my work because I just couldn't even communicate on the phone. And I laid on the couch for a week and I felt light and sound and temperature change. Like all of my emotions were connected to senses and stuff. And that's when I started realizing like, hey, maybe I'm on the autism spectrum, because this is like reminding me of a lot of stuff I feel people talking about from autism. And a week later, I raided the fridge. My wife had made deviled eggs, and I ate like 6 eggs total or something. Yeah, 12 deviled eggs, which is half. And I woke up next morning and I was like, oh my God, I can think again. And I like just flew into research and I was like, okay, eggs are loaded with sulfur, zinc, copper and stuff. And I just started trying to load up on some of those things. And for a solid month, I was converting Epsom salt and water and black sesame seeds on my food into diarrhea that was just like bringing my brain back. Like for a solid month, I was having diarrhea and I was just feeling better and better. And that was the first round I went through where I was like, okay, there's some kind of pathway or something in here. Like, I don't know what it is, but nutrients go in and they combine and they go do something. And I think we have to find the ones that our body needs right now. And I just kept going.
Did you figure it out? Why the iodine? Did you figure out why the iodine did that?
So I think iodine apoptosis a ton of my cells and like knocked off a bunch of this. I think I had mercury loaded from the flu jab, and I figured out over time, I had a memory flashback of my mom laughing, and then I saw both of my grandmothers laughing, and I had mouthful of mercury fillings. And this is when everything started coming together. I was like, that's why I was a spastic kid and I couldn't pay attention to anything and I was always getting in trouble. And then now a flu jab has mercury in it from the multi-bile, and I feel like I just overwhelmed my system, knocked out my ability to methylate, metabolize, and everything, and I think I just knocked all of that loose with iodine into my system that can't process it, which is where I need to build up my glutathione and stuff, and that was just, I kind of brought those things together. And
okay, so now, from my standpoint, the iodine has a problem, because what it does is it increases thyroid function. You're going to increase T3 and T4. Okay, now T3 and T4 are based on the amino acid tyrosine, iodine, and globulin. The tyrosine is also the precursor for dopamine, norepinephrine, and epinephrine. So if you suddenly throw in tons of iodine, the tyrosine gets forced over into the thyroid pathway, and it drops the dopamine, norepinephrine, epinephrine pathway into the floor. Okay, in doing so, you lose your major neurotransmitter sets. That'll make the confusion, lack of focus, inability to think like crazy show up. On top of that, when then you threw in the eggs with the sulfur then kicks in the PUMT enzyme, which causes the norepinephrine to epinephrine shift and pulls the tyrosine back from the iodine in the thyroid and dumps it back into the catecholamine pathway, so you get an increase. So this would be a balancing effect that you were doing by pushing it in that direction. The glutathione would keep enough methylation going that the PUMT and the COMT would be active and functional. So it's an interesting piece. You found definitely an interesting way to come out of that by trial and error. And chemically, it's got a sound basis from a biochemical standpoint. So I would definitely say, good job.
Aww.
Yeah, I at least found my way through it, because I look back and I'm watching people and I'm like, holy crap, how did I get through that? Because not many people are...
No, you did a good job. As far as the mercury goes, it depends. Mercury depends on a lot of different things. And it depends on whether or not you've got the genetics and the proper enzyme systems to remove it. Okay? Mercury, arsenic, all of those kind of things. The exposure from mercury is everywhere. And you can't get away from it. You eat a piece of fish, you got mercury. You bathe in a stream, in any stream in the United States, you got mercury.
Yep.
So there's mercury everywhere. So the mercury is not the biggest problem. Most of the time, that just leaves you brain dead. You can't, you're just brain dead.
So that's the weird part is before all this, I didn't realize, but I was going brain dead. Like I was an idiot that was not paying attention. And through several rounds of this, I was like, holy crap, I'm getting my brain back. One interesting round was, I think it was like pretty early in starting iodine. It was before I tried high dose. And I'm sitting here one night and all of a sudden my arms got really heavy and my head and stuff. I felt like what I assume people go through on like a dope kind of drug, like heroin or something. Like everything just felt really, like I felt good, but all my limbs felt real heavy. And then the next morning I woke up and I felt like I had jumper cables hooked up to my brain. I like popped out of bed at 6 o'clock, which I don't usually do. And I was like, oh my God, I think I just figured out this thing about the universe or something. Like my brain was just on fire. And I was like hoping I was going to keep doing that with iodine, but it was the only time that happened like that one time. But
but that was the beginning of the tyrosine shift. The muscles that control your neck from the base of your skull to the tip of your shoulder blades to the middle of your back is the trapezius muscle. It has direct control by the sympathetic nervous system, which is your dopamine, norepinephrine, epinephrine shift. Okay, so when you're falling forward and you're sinking, it's because the pathway crashed. Okay, but the body won't let the sympathetics crash because your heart stops, so it counter fires immediately, and that's why you felt better in the morning. Interesting secondary looks at stuff.
Yeah.
So do you don't, like you said before, that you see people or you have people come to you, like, just like, how does that explain that?
So I've been trying not to do one-on-one. What I've been attempting to do that didn't work out the way I thought it was to help people in public and just do like crowdsourcing and making videos and stuff, which it was working at a time, but then Facebook completely like shut off my view to anybody. And I was finding people to help support, and then I was doing like webinar kind of things. So it was kind of like doing one-on-one, but with more than one person, just to try to answer some of these questions. That's where I was going with it. But I think now what I'm going to do is I found somebody that's getting into, like, they're trying to get in the grants for autism research to help moms that are struggling with, like, everybody's stuck on, it's gut health for autism. Like, we need to fix our gut. Like, just try to get information that moms can take in and realize, like, maybe there's other things that we need to carefully try to see if that's what somebody needs support in, instead of just thinking, we fix the gut or we fix this one thing. It's just, everybody's got this, we just need to go after this one thing. So
it's a medical mindset.
Yeah, medicine is a pill for everything.
Yeah, medicine is really ingrained that into people, is that one disease, one pill, one disease, one cure, and they basically push that down everybody's throat. The problem with it is that human beings aren't a one system. There is no one system for us. There's too many of them. So I applaud you on that. The problem I always had with the internet is it's kind of like standing in a football stadium that's packed and start screaming while everyone else is screaming.
Yeah, pretty much.
I'm a special education teacher, and I've taught so many autistic kids, and it actually, as an educator, I'm most fascinated with autism. You know, it's so interesting to me to sit with an autistic student, you know, and just kind of see how their mind works, you know, and you just think, like, you're so smart, and you just have this inability to express it, and I just want to, like, dive into their brains. I had this one girl who I tutored for years, and she just so fascinated me, you know, and I had a student last year, and he was more Asperger's, and
It's obnoxious.
and it's rough, but he's such a fascinating kid. Like, you just have to, like, what is going on in your mind? You know, I mean, I've taught severe and profound autistics too. That's a whole, you know, another realm, and I'm sad for the families, you know, but it's a very, very interesting disability.
Well, spectrum disorders at this point, they're just lumping everything underneath it.
Well, the special education world, you know, they're diagnosing everybody with anxiety. Oh,
Right.
the anxiety
Well, it used
or
to be
ADHD,
ADD.
anxiety, ADHD, you know, that's what I see continuously over the past 5 years, you know, and being someone who was almost housebound because of severe anxiety and panic disorder, when I see that on an IEP, I'm like, no, I'm teaching this kid what they have is they're anxious. There are kids, obviously, who have anxiety and panic, but they're lumping anxiety and anxiousness into the same disability, and it makes me cuckoo because I'm like, no, he's just, or she is just anxious. They're not having anxiety panic, you know?
Yeah. Yep.
Well, it's the
Eat some turkey.
Of,
No.
it's the stupidity of trying to categorize everything so that it fits into the screen you're looking at.
Yeah.
That's really what it comes down to. As far as the spectrum disorders and all that kind of stuff, they're just dumping everything in there so they get credit for it, and they can give people Ritalin legally, and that makes them so hyper-focused they can't do anything else. And they're just happy they make it through the school.
How would you treat an autistic kid? Just
I treat
generalized.
tons of
I know.
There is no one treatment for autistic because they're not.
The same.
None of them have the same brain malfunctions. There's no genes that have been definitively looked at and proven to be autistic. Nothing. Okay.
So, how did you treat one patient with autism? I'm just
Depends
curious.
on what type they have.
I don't know. Give me any patient. Just an
Okay, I got
example.
one kid who is basically a talker.
Okay.
He would just talk. Whether you were listening to him or not,
Right.
whether anybody in the room was listening or not, okay? For him, he had a fault in the GABA system. He wasn't making enough GABA. So we gave him GABA as a supplement. And it slowed him down enough so that his parents could actually get a word in edgewise. Did it correct the problem? No, because it's a lot more complex than just GABA.
Right.
Okay, GABA is just one, then it cascades out into a million other chemicals. So the point comes down to is that's just a help. When you're doing nutrition work, from my standpoint anyway, what you're trying to do is balance the system and get it to an even level, wherever that level is. Once you do that, then that person can try and pick the whole level up with other things.
Right.
But they've got to be on a stable level. If you're flying like this, there's no way in hell that you're going to be stable enough to do anything or have any functionality.
And if you just stabilize things, they might be able to now slowly move forward with diet instead of just constantly trying to stay above of whatever metabolic imbalance is holding them back every day.
Yeah, well, once you've got the right fuel for the right engine, the engine will run.
That's
It
what
may
we
not
said in the
run
book.
it may not run like a Ferrari, but it'll run like a
Yeah.
Volkswagen, but it'll run.
It'll get you home.
Yeah.
And that's what people are trying to do. And people don't realize they're breaking down. They just want to get home, get to the next thing, and not figure out how to continue doing that. They're looking for that one solution. Which is
Yeah.
part
Now,
of the
that's
problem.
always the biggest problem with them.
Yeah. Well, Dr. Dulin has a patient at 6:50. Where are you located? You in New York too?
I'm in West Virginia. I'm Eastern Standard Time.
Oh, okay.
Oh, West Virginia.
So I will. I'm going to stop recording now. Hold on.